Hello, everybody. Ray Pedras on the McAllen Cable Network. You know, we've been hearing for a long time now about Obamacare. Well, you know what? Coming up very soon, Obamacare is going to affect all of us. What is Obamacare? Well, let's talk about that and how it's going to affect you. Joining me right now in the studio is Cynthia Reyes. She's with the Office of Congressman Ruben Hinojosa. She's a district director. Also, Robert Sada. He's a field director from the Office of Congressman Hinojosa. And also Christian Munoz. He's a community outreach director for Nuestra Clínica del Valle. Welcome to all of you.
Thank you.
Thank you for having us.
Hey, so let's just assume we don't know anything about Obamacare. What is it exactly, and how is it going to affect us?
Well, before we actually get into the technical details, Ray, just so that the public's aware, the Congressman has been working diligently with his Edinburgh District Office to make sure that his constituency will be ready come October 1st when enrollment does start. We have partnered up with many different organizations. The Congressman has made sure that we hit every entity that will be affected, from healthcare to education to our nonprofit organizations. Our goal and the Congressman's goal is to make sure that we have enough boots on the ground to get that information out to our constituency. We're looking at about 256,000 constituents just in Hidalgo County that are uninsured. And that's why it has been so important for Congressman Hinojosa to make sure that his constituency is aware that affordable health care is here and it's going to start October 1st.
All right.
So.
And Robert, what exactly happens on October 1st? What do people do? Why do people need to be aware of that deadline?
So on October 1st is when the official Affordable Care Act marketplace opens. So from the period of October 1st to March 31st will be when open enrollment happens. Now, for the people who have never had insurance before, open enrollment is when they'll have the opportunity to sign up for health insurance. What will happen on October 1st is that is the official launch date for the federal marketplace. The federal marketplace is going to be an area where the public will be able to see a variety of different health insurance plans. And through that marketplace, they will be able to pick and choose which insurance is right for them.
Okay. And who qualifies? Like, how does somebody know that they qualify?
Well, right now, the people who qualify are any U.S. citizen or any legal permanent resident who has been here for 5 years or more. So just to clarify, the people who do not qualify would be undocumented immigrants, any deferred action for childhood arrival student, or any person who is currently in prison.
Okay, and we ask that people take this seriously because come January 1st, if I'm correct, people will actually get fined for not having insurance.
Actually, just to clarify, that the penalties for the Affordable Care Act will not kick in until tax season of 2015.
Oh, okay.
Yes, what happens on January 1st is that's when the actual coverage starts.
Okay, gotcha.
So if I were going through enrollment, say I don't have insurance right now, I would apply through the marketplace, either online, over the phone, or via snail mail. And what will happen is, say I start and I go through the marketplace in December. My actual health care will kick in on January 1st. So then that's when I would be able to go to and take advantage of all of the benefits that the health care would provide.
Okay, and we're already hearing on the news about people being scammed out there. How do people avoid being scammed? How do they know that whoever they're talking to is legit?
The best thing to do is to go straight to the federally funded sources. So one thing they can do is they can go to www.healthcare.gov to look for any and all information concerning both the marketplace and the Affordable Care Act. And also there has been some federal money appropriated for specific organizations called navigator organizations. And these organizations have the training and have the legitimate resources necessary to assist the public in acquiring health care.
Hence the reason Christian Munoz is here with Nuestra Clínica del Valle. Welcome.
Thank you.
And so what exactly are you doing?
Right now, we're actually, like Robert mentioned, we receive funding to assist a lot of the residents in Hidalgo County with their enrollment applications. So we'll have offices designated with our workers assigned to assisting everybody in the community in Hidalgo County and Stark County as well with these applications. So we'll be taking care of all their needs, any questions that they may have. So we're really a good source for education on the program and the actual enrollment into the program.
I know this help is available in English and in Spanish, right?
Correct.
Very good. And they can also, as you mentioned, go on the web and research these plans. What other information do people need to know about this October 1st date?
They need to make sure that if they want actual information, that it's very important that they either go to a navigator organization like Nuestra Clínica, or they call the Congressman's office. That is why the Congressman's office is here. We want to make sure that this is a smooth rollout. There are going to be a lot of technical questions once they actually get online and start looking at the plans. So the public just needs to know that the Congressman's office is a resource, and those federally funded organizations like Nuestra Clínica are also a resource, because for some constituencies, it could become very difficult, but that is why we're here. We're here to help the constituency as much as we can.
Very good. And are there going to be any other locations in the community where this type of information is going to be available?
Yes, 2 other organizations also received funding.
Okay.
One of them is the Area on Aging, which is located in Weslaco, and the other is Migrant Health Promotions, which is also located in Weslaco. For your viewers in Brownsville, there's Su Clinica as well.
Okay. And here in McAllen, would they be able to find them at city or county offices? Like maybe flyers or any information?
Well, actually, we'll have various locations. It's not just Nuestra Clínica in San Juan. We'll actually have 6 different locations assisting with this. Our locations will consist of 2 locations in San Juan. We'll have Mission, Donna, Mercedes, and Rio Grande City that we'll be assisting with.
Okay.
And along with that, with our outreach, we have already spoken to our county commissioners, our county judge. They're very much aware that ACA is here, and so we'll also be working with their offices, with their precinct offices, to make sure that they have the information available for those constituencies as
Very
well.
good. And I guess this is for all of you, but are people already asking about this, or do you think that people are just not aware that it's coming? What is your gauge on how the community is
It's very
feeling so far?
interesting because from what we've heard, a lot of our state offices, our state representative offices, have already received phone calls about affordable care. Do they need to apply? What happens if they don't apply? Christian can share with you as well that they have gotten numerous calls, not only from the patients that they serve currently with Nuestra Clínica, but also outside constituents as well, asking about affordable care. So it is, the constituency is aware, but then they won't really see the impact until October comes. And so that's why it's just really important, because there are penalties that could affect our constituency, and we want to make sure that they are not in that position where they're going to have to pay a penalty come 2015.
Very good. So people are inquiring, and as these dates get closer, I'm sure more people will start asking even more.
Definitely.
And Robert, you mentioned that people can start enrolling as of October 1st, and they can enroll through when?
They can enroll from October 1st through March 31st. However, for whatever reason, if they have a life-changing event after this 6-month open enrollment period, there will be special enrollment for them. And some examples of life-changing events are if someone gets married or if they have a divorce. Clearly their family structure changes, so then they would be able to go once again into the marketplace and find an insurance that's right for them.
Okay, and regarding income levels, can you talk about that a little bit?
Sure. Right now, the Affordable Care Act, again, one of the key parts of it is to make healthcare more affordable. So what the government has done is that if, for instance, you're applying for health insurance through the marketplace, it will provide you with rates for each individual plan, and each individual plan will already include a subsidy, which is being provided by the federal government. Now, what this subsidy means is that it's going to be at a discounted rate based on your income. So if in the past health insurance was not affordable for you, it may be that through this new marketplace you will be able to find a better rate for the plan that you're looking for. Now, currently, and this might be a little technical, currently subsidies are available for people who make between 100 and 400% of the federal poverty level. Now that changes based off of your family size. So for instance, if you were a family of 4, if you're making anywhere between 20,000 and I believe it's 60,000, I will have to double check, you will qualify for a subsidy or a discount on your health insurance. One of the challenges that's facing Hidalgo County and the state of Texas in general is that the Affordable Care Act was made under the assumption that all states would expand their Medicaid program. The state of Texas, however, is one of 13 states that opted out of that expansion. So what we have is we have a coverage gap, and that coverage gap indicates that people who make Depends again on the family size. But people who would have been covered under Medicaid expansion are not going to be covered through ACA. So what that means, let me see if I can simplify that a little bit.
I think what Robert is trying to state that that individual that would have been covered under Medicaid expansion, what is going to happen to that individual is they're still going to have to go through the process of applying for affordable care. Affordable care, the federal government is going to accept their application. Once they get their application back saying that they have been accepted, more than likely they're going to see the amounts of what each plan is going to cost. That individual will more than likely not be able to afford the affordable care plan. So what is very important that our constituency knows, that if their family is going to fall under this umbrella, that once they get accepted into affordable care and they're able to pick a plan, if they cannot afford that plan, there is going to be a hardship waiver available for them. But in order for them not to be penalized, they will have to fill out that hardship waiver and turn it in. That's why it is so important that our constituency is aware, because we have many constituents that fall within that Medicaid expansion. And the only way they will not be penalized is if they fill out that hardship waiver form.
And if they need that hardship waiver form, they can contact your office, or could they contact Nuestra Clínica as well?
They can contact us as well. We'll be assisting with that form as well. Anybody that is, like they mentioned, that they won't be able to afford the Affordable Care Act plans, they can fill out the forms with us in our offices, or they can fill them out online as well.
Okay.
And Ray, what we're finding is, just so that the public is aware, the hardship waiver form right now is very general. And so more than likely, if you're a student who is not covered under your parents, or for some reason you opted out of the university insurance plan and you still can't afford it, whether it's because of rent or providing food for your family, you can still fill out that hardship waiver form. So the best information that the public can receive is, if you feel that you can't pay for that affordable care, please fill out the hardship waiver form.
And ask you guys, because you're there to
Yes.
help. All right, very good. Anything that we're leaving out that the public should be made aware of at this time, do you think? Did we cover it all?
I think we have covered a lot of it. Very basic information. Again, if the public has any questions at all, we are a resource. The Congressman's office has always been a resource, along with our navigator organizations as well. So please feel free to call the office.
Okay, and you have a website, and Nuestra Clínica has a website as well, and we'll put those websites on the screen for everybody, and along with your phone numbers. Thank you guys so much.
Thank you.
Thank you for having us.
Appreciate,
Thank you.
making the public aware of this big information.
Yes.
All right, thank you so
Thank you.
much. All right, and as always, we thank you for watching. I'm Ray Pedraza, and this is the McAllen Cable Network.